Hi, Dr. Walter Tatch here, and this is the case of reconstruction of severely atrophic anterior maxillary ridge. You can see a dentulous area of tooth number 7. The tooth is congenitally missing. We're going to use a combination of BMP. You can see extra small kit reconstituted and mixed with the mineral bone graft, and a titanium reinforced membrane is going to be used to contain that. The titanium reinforced membrane is going to be advanced, and we're basically going to secure it to the palatal area. After the surgical site is reapproximated, we're going to use StellaLife VEGA oral gel over the surgical site, over the suture line in the vestibule, and the patient is going to continue using StellaLife VEGA oral recovery kit for postoperative management to decrease swelling, bruising, and pain, and to give us a accelerated healing. When the patient comes back only a week post-op, and this is a BMP case, remember we usually get a lot more swelling. You can see the swelling is fairly minimal. The tissue looks like you would normally see it 3-4 weeks post-operatively with a surgical procedure like this. The case clearly showing advanced healing and beautiful results, and this is what we usually see with patients who are using StellaLife products for post-operative recovery. Thank you.